very short and synthesized results and methodology that we used for this very, very useful, I can say, research that we've done for the first time in Kosovo. So we all know how pandemic started. I'm not going to go deep into that. We all know the situation. We went into unprecedented till now health crisis in the whole world. March 2020 declaration of pandemics by WHO. So we've seen dramatic changes, unexpected events, and we've seen overwhelming of all health systems throughout the world, not to mention Kosovo as being such a young and fragile country in Europe. But we've developed in many ways during pandemics because we came back to digital technologies. We improved our international cooperation in public health. We improved teaching. We've done it online. Even for small children. So besides of having all the consequences, I think we also, in a way, we have also advanced, in particular in digital technologies. Just a reflection. These are the Spanish steps in Rome before pandemics. So this is the view during pandemics. It's completely deserted. This is public beach in Rio de Janeiro in Brazil. But during pandemics, what happens? It's completely deserted. So even during my PhD thesis presentation, I wanted to put this to just without words showing what we were before pandemics and what happened during 2019, 2021, when not many things were clear. So in Kosovo, we have started preventive measures even before having first cases. Of course, we were all in alert and in presentation. March 13, we had two confirmed cases. And then what we've done with this study, basically we started at the very beginning of pandemics. We had full support from WHO office in Pristina and in Copenhagen. And it was, as you will see now during my presentation, how we use those evidences and how it was done. Imagine it was all done online. This was all done in the very beginning. First wave was done September, October 2020, when we didn't have any answer, when we were just engaging and when we started to learn something about pandemics. But this study, not only that was realized for the first time in the Balkan region, but our results were presenting like scientific knowledge, behaviors, and the perception of population regarding COVID pandemic. And it included many, many variables like health knowledge, financial situation, negative pandemic behaviors, trust that population show in state institutions, in policy, in education, and other institutions. And all this was in connection with COVID-19. As well, COVID-19 vaccines that at that time were not even invented by the scientists. General objective was to analyze a one-year cohort of multi-series profiles. We call them research waves. You can imagine research wave as one research realized during some period, like 2 weeks or 1 week. And what were the specific objectives were to assess the link between preventive and awareness measure and population. So what population thought about the preventive measures that the state was giving. And then it gives us new evidence on knowledge, behaviors, perception regarding demographic differences in different samples, like as per age year, then gender, socioeconomic factors, etc. Also, we were able to identify and evaluate pandemic fatigue and also compliance level and resistance factors that were seen among population during these various periods for 1 year. Okay, it was realized from October 2020, July 2021. In total, we were able to deliver 5 waves. After that, we realized 2 more waves, but they were not compiled in my PhD thesis. And we had in each wave we have at least 1,000 effective interviews. So in total we had 5,016 effective interviews with a CATI methodology, so computer assisted telephone interviews. This is what we've done. I'm not going to go deeper into that, what statistical analysis we've done and how we had ethical approvals from different chambers, starting from NIPH, then Faculty of Medicine, and of course, Kosovo Medical Chamber. They had to approve before going out and doing the research. And different variables, we had at least 20 variables: socio-demographic, health, education, trust, behaviors, etc. Just shortly, I'm going to brief on the 5-wave results. I didn't include any graph, any table, because I didn't want to be like more scientific. I wanted to have it simpler so that people who are not with medical background can also understand it. And this is my, this is just like a short synthesis of all that. So when we did research on September-October 2020, first wave, 87% of respondents, they were very worried about their economic future. They had high compliance with the masks and hand hygiene, more than 90% of the sample. At this time, vaccine willingness was only 36% of respondents. More than 50% they didn't agree for having vaccine in the future. They trusted very low in government, and their health status was linked to vaccine hesitancy. I like this photo because it shows a young lady in one of our streets of Pristina going out with her dog when we had this curfew and when we have these restrictions. Also, this is the second wave that was realized month after, November 2020. And also the picture, I see it, I love it very much. I still remember the title that we had on the newspaper. So the dogs were asking, where are people? And this is city center of Pristina. It's completely deserted, except for these 2 dogs who are hugging each other. And they were wondering, where are all the people? So during this wave, 53% reported that they have worsened their finances, and 81% they were again worried about their economic status. They continue with high compliance with preventive measures. Vaccine willingness was almost the same, and we started having increase in health trust in health sector and media monitoring. This is, we go to year 2021, January, February, when we realized third wave. At this time, we have some like negative indicators, they start to decline. And vaccine willingness is almost the same. And the support for government was around from 60 to 86. We see a bit of, lowering for the said events. You can see here this logo. It means Together Against COVID. It was a major awareness raising campaign that was fully built up upon evidences that we had from the first and second wave of this research. So evidences that we got from this research, we immediately used for building up a massive awareness raising campaign that was done, you can see, with the stakeholders here, international organization, but also local level we were engaged. And we produced a lot of awareness raising materials, a lot of video that were giving facts, and that we were fighting myths for COVID-19 that were existing at that time. Fourth wave, March 2021. At this time, we started, or at least in Kosovo, vaccines were not yet available, but we were working on having them. And we've seen that vaccine willingness has risen to 45%, 32% still opposed, and 72% supported the national regular vaccination plan. Financial and economic worries were at that almost steady throughout the research time. And negative behaviors I have mentioned here, but I need to mention that from like 18% of people avoided medical visits that were not related to COVID-19. And they continue to bought drugs that they heard they could help against COVID. And in the end, in the last wave, I think this percentage was like 75% of people, of respondents. And that was very, very worrying. And it was like a red flagship that we notified and immediately health authorities and the Ministry of Health, because unfortunately here in Kosovo, we can buy antibiotics without prescription. We can buy whichever medicine that we want or we seem like we need it, so we can buy it for ourselves. That's why avoiding medical visits that are not related to COVID-19 and buying medicines that we thought they could help are some of the key findings and negative pandemic behaviors throughout the whole cycle. Last wave that we included here was wave 5th that was realized in July 2021. At that time, we started the vaccination plan. A vaccination plan was in place and it was implemented by Ministry of Health and IPH. And at this time, at least 21% of the sample that we interviewed was vaccinated. Among those who were not vaccinated, like 54 or half of them, they expressed willingness that they would vaccinate in the future. And 13% of the whole sample was the percentage that the whole time was opposing the vaccination. And I think this is still the same because in researches that we've done later on in 2 more waves, this 30% changed 12, 30, but it was around like this, who are vaccine hesitant, we can call them. Also, in the last wave, we see declining of information seeking, like in beginning of pandemic, people were searching like 90% all the time information, many times a year, during the day, non-stop, I can say. They started declining, and also they reduced perception of excessive restrictions, and half of them saw decision as fair, half of them they opposed, they thought decisions were not as good as they should be, state is very restrictive, now COVID is gone, etc. What we've seen from demographic differences, we've seen that younger population show much more lower compliance with all the measures, also when it came to vaccination as well. Urban areas had higher adherence than rural areas. Of course, we can understand because rural are more like families, so they didn't fully respect the restrictions. Of course, we have experiences like my husband and my son during curveys. They went to village because they could see each other. They could walk in the nature. And contrary, being in city, we had many more restrictions. Also, education level correlated with preventive behavior, which is, I think, understandable. Also, we did analysis on correlation with government measures, and we've seen that compliance with measures linked to trust and vaccination. Measures were positively linked with the trust and with the vaccination intention, but negative correlations, policy reduction linked to undesired behaviors. Majority of population were aware of COVID-19 preventive measures. Please take this in consideration, in particular during the first waves when we were in the beginning of pandemic and we didn't, ourselves as well, we didn't have fully information or full knowledge of what's going on, how the disease is spreading, we knew that it was a SARS-CoV virus, but we didn't know how it's spreading, how much it's living in the surfaces, etc. So government and media played a significant role in information dissemination. We know that for sure. And misinformation affected only some population groups, not all of them. We've heard during COVID-19, we've heard the definition of pandemic fatigue as well from the WHO, and we've seen that it's like when people get tired of following all the measures and following all the government restriction and instructions. So we start having pandemic fatigue. We had 3 variables that we followed, how to say, monitored during our research, like using hand sanitizer, physical distancing, and using masks. And we've seen with the statistical analysis that we've done, we've seen that all of them, they were much higher at the beginning, but they all declined during as the pandemic was progressing and as we were moving to the year end of year 2021 on second year of pandemic. This is what I said. So it was like in the beginning we had these results, but then we start seeing evaluation of pandemic fatigue among population. So here we have it with numbers as well. 2020 we had high compliance, like 90%, but we dropped to 69, 60 in 2021. And research that was done by WHO in 2020, we've seen that almost 60% of population in Europe had pandemic fatigue, even during first year of pandemic. This is like a discussion. Similar results were found throughout the Europe and throughout the world. We've seen these economic concerns. They were similar to other European countries, like in Finland, and also negative behaviors were almost same. We know situation was the same, and how people react was almost the same. And that was one major positive thing about this research that we've done in Kosovo and in Balkans for the first time, because we, as a new country, to say, and a small country compared to other countries, were able to have a database with the data that we can compare with the region, with Europe, and with the world. So above all, besides of having a doctoral thesis on this and having the research, I'm so happy that we managed, as Department of Social Medicine Department, I managed to have ongoing this research and also be at the same level with other countries. So we can see that vaccine refusal from 53 wave 1, as I said, lower to 13%, and hesitancy was much higher among women under 30, I said younger respondents, but in particular female. And but the intent to vaccinate has risen from 36% to 66% within a year, and this is a publication that we made on pets innovation, Elsevier. What were other findings that we had? Distrust, this is general for all. I mean, like distrust in government policies affected adherence, conspiracy theories, and economic constraints limited access to the protective equipment most of the time. So I'm going slowly to the end of presentation. I think I compiled 20 minutes now. So what were the major conclusions that came out from this research? Like public trust and misinformation shape preventive behaviors. We had high health education, but also people were educated, they had knowledge, they started having negative pandemic behaviors. Trust in health professionals remains strong throughout the whole reporting period. We've had a presentation in Regensburg in Germany in a conference. This trust from out of 7 Richter scale, it was constant between 5.67 in health professionals. Accessibility and economic factors, I stated earlier. And then this research informed, one of the key points is that this research has informed public health policy in Kosovo, as I said earlier in the beginning of my presentation. Overall contributions to public health in my country, so it provided realistic overview of the situation in the ground. It served as a foundation for evidence-based policy decision and more effective tailored public health interventions. Like when we've seen that younger females were refusing vaccination, then we developed materials, we developed videos and other education materials to give them evidence, to tell them that vaccines are good and vaccines are working. Also, we applied the COMBI model as a modern behavioral science model adopted from WHO. Besides for this research, after this COVID-19 researches, we've done three more research, and 2 were done on HPV vaccine and 1 on routine vaccination, also done with our partner organization, WHO and UNICEF in Kosovo. Also from this collaboration, Kosovo has managed to have a focal point at the country level, which happens to be me. And I was designated from the Ministry of Health and the National Institute of Public Health for Kosovo. So we are on a regular contact with the WHO office in Copenhagen, and we are updating and we are evaluating and we are doing more researches. These are just the scientific papers and the presentations that derived from this research. I'm not going to go into that. And what were some of the recommendations? I mean, strengthening health systems through strengthening human capacity, medical supplies, infrastructure, then continuous surveillance and really monitoring of outbreaks, harmonization of public health policies at regional and global level. Then also lesson learned is to address misinformation through reliable resources, strength and support system for economic, in particular for all, but in particular for economically vulnerable groups, encourage community-based initiatives to promote adherence as much as we can. I would like to appreciate the state organizations that helped us in conducting this research and still being up to date up to now with the Europe as well and the other countries. So I would like to thank WHO European Regional Office in Copenhagen, Office in Pristina, my institute, National Institute of Public Health, Faculty of Medicine, University of Pristina, AQH project in Kosovo, implemented by SPIS Tropical and Public Health Institute, STC. Of course, Lugano Summer School for having me here and giving me the opportunity to be this minutes online with you guys. So in the end, I thank you for your attention, and I think now we are open to discuss.